26. The mode of heat transfer by hot pack, whirlpool bath, paraffin wax bath is Option A. Conduction and conversion. Option B. Conduction and radiation. Option C. Radiation and conversion. Option D. Conduction, radiation and conversion. And the answer is Option A. Conduction and conversion. Now let's move to question number 27. The tissue that accumulates maximum heat with condenser field application of SWD is Option A. Skin. Option B. Fat. Option C. Muscle. Option D. Blood. And the answer is Option B. Fat. Now let's move to question number 28. The therapeutic frequency of SWD is Option A. 27.12 kHz. Option B. 27.12 MHz. Option C. 27.12 GHz. Option D. None of the above. And the answer is Option B. 27.12 MHz. Now let's move to question number 29. The beneficial effects of PSWD is in accordance with Option A. Van Dorf's rule. Option B. Joule's law. Option C. Arnold-Scott's law. Option D. None of the above. And the answer is Option C. Arnold-Scott's law. Now let's move to question number 30. The depth of penetration of microwave is Option A. Greater than shortwave. Option B. Lesser than infrared. Option D. Greater than infrared and lesser than shortwave. Option D. None of the above. And the answer is Option C. Greater than infrared and lesser than shortwave. Now let's move to question number 31. For tennis elbow, the laser dose is Option A. 1.5 joules per centimeter square. 5 joules per centimeter square. Option C. 16 to 24 joules centimeter square. Option D. 8 to 12 joules per centimeter square. And answer is Option C. 16 to 24 joules per centimeter square. Now let's move to question number 32. Absorption of ultrasound is greatest in the tissue with Option A. Greatest water content and least structural protein content. Option B. Greatest water and structural protein content. Option C. Lowest water and structural protein content. Option D. Greatest structural protein and lowest water content. And the answer is Option D. Greatest structural protein and lowest water content. Now let's move to question number 33. The purpose of application of pulsed ultrasound is to Option A. Dissipate the heat in the interval. Option B. To produce higher mechanical effect. Option C. To lessen the thermal effect. Option D. To lessen the thermal effect and increase the mechanical effect. And answer is Option D. To lessen the thermal effect and increase the mechanical effect. Now let's move to question number 34. The approximate average half-value depth of ultrasound of 1 MHz frequency is Option A. 100 mm. Option B. 65 mm. Option C. 35 mm. Option D. 25 mm. And the answer is Option B. 65 mm. Now let's move to question number 35. Among the following electrotherapy modalities, which is the right sequence of decreasing frequency? Option A. Infrared, ultrasound, shortwave, interferential. Option B. Infrared, microwave, shortwave, interferential. Option C. Ultraviolet, microwave, infrared, interferential. Option D. Infrared, ultraviolet, microwave, medium frequency current. And answer is Option B. Infrared, microwave, shortwave and interferential. Now let's move to question number 36. The post-operative physiotherapy following putty pallet surgery for anterior recurrent shoulder dislocation are Option A. Isometric contraction of rotator cuff after surgery. Option B. Active movements can be started after 3 to 4 weeks. Option C. Mobilization of shoulder can be started after 3 to 4 weeks. Option D. Progressive strengthening can be started after 3 to 4 weeks. And the answer is Option A. Isometric contraction of rotator cuff after surgery. Now let's move to question number 37. AC joint, that's acromioclavicular joint injury can be managed by strengthening dash muscles. Option A. Rotator cuff and deltoid. Option B. Deltoid and trapezius. Option C. Trapezius and serratus anterior. Option D, rotator cuff and serratus anterior. And answer is option A, rotator cuff and deltoid. Now let's move to question number 38. Positive Hudson test indicates TOS due to thoracic outlet syndrome due to option A, scalene, option B, cervical rib, option C, reduced scapulo-clavicular angle, option D, tumor. And the answer is option A, scalene. Now let's move to question number 39. Physiotherapy for thoracic outlet syndrome includes option A, stretching of scalene, levator scapulae and pectoral to relieve pressure. Option B, strengthening of stapedius and serratus anterior to correct posture. Option C, modalities like ultrasound most to relieve spasm and tense, IFT to relieve pain. Option D, all of the above. And the answer is option D, all of the above. Now let's move to question number 40. Cross-back position of humeroulnar joint is option A, extension, option B, 50 degree of flexion, option C, 70 degree of flexion, option D, 90 degree of flexion. And the answer is option A, extension. Now let's move to question number 41. Resting position for humeral radial joint is option A, semiflexion and supination, option B, semiflexion and pronation, option C, extension and supination, option D, extension and pronation. And the answer is option C, extension and supination. Now let's move to question number 42. Capsular pattern of limitation of elbow joint is option A, limitation of flexion, option B, limitation of flexion more than extension, option C, limitation of extension more than flexion, option D, limitation of extension. And the answer is option B, limitation of flexion more than extension. Now let's move to question number 43. Extension of elbow is associated with option A, ulnar abduction and forearm pronation, option B, ulnar abduction and supination of forearm, option C, inferior glide of the ulna, option D, superior glide of the radius. And answer is option A, ulnar abduction and forearm pronation. Now let's move to question number 44. Flexion of the elbow is associated with option A, inferior glide of the ulnar and superior glide of the radius, option B, superior glide of the ulna and inferior glide of the radius, option C, ulnar abduction and forearm pronation, option D, radial adduction and forearm pronation. And the answer is option A, inferior glide of the ulnar and superior glide of the radius. Now let's move to question number 45. Usually the direction of elbow dislocation is option A, backward, option B, backward and lateral, option C, backward and medial, option D, forward. And the answer is option A, backward, and sometimes backward and lateral. Now let's move to question number 46. Following fracture supracondylar of the humerus, small distal fracture segment is displaced backward. Uncorrected displaced fracture will limit dash movement. Option A, elbow flexion, option B, elbow extension, option C, forearm rotation, option D, alter the carrying ankle. And the answer is option A, elbow flexion. Now let's move to question number 47. Tennis elbow may involve option A, common extensor origin characterized by the pain during restricted isometric contraction, option B, radiohumeral or superior radioulnar joint characterized by the pain during the joint play, option C, lateral collateral ligament or annular ligament characterized by pain during passive movements, joint play and stress test, option D, all of the above. And the answer is option D, all of the above. Now let's move to question number 48. Typical tennis elbow involve the common extensor muscle. Which muscle is commonly involved? Option A, extensor carpi radialis longus, option B, extensor carpi radialis brevis, option C, brachioradialis, option D, extensor indicis. And the answer is option B, extensor carpi radialis brevis. Now let's move to question number 49. VIC, Voltzmann ischemic contracture following fracture supracondylar of humerus results from option A, injury to the brachial artery by projected sharp proximal segment of the humerus, option B, tight plaster, Option C, excessive elbow flexion during immobilization. Option D, all of the above. And the answer is option D, all of the above. Now let's move to question number 50. Distal articulating surface of the radius faces. Option A, inferiorly. Option B, pulmonarily and ulnarly. Option C, dorsally and ulnarly. Option D, pulmonarily and outward. And the